Ever looked in the mirror after major weight loss or pregnancy and thought, where do I even begin? Loose skin on your stomach, thighs, arms, and butt can feel overwhelming, and Googling body lift only adds to the confusion. So, we're going to talk today with Dr. Johan Brahme. He does a ton of body lift work, and we're going to break it all down. We're going to find out, should you do it all at once? Can you do it all at once? And how do you decide what comes first? So, welcome, Dr. Brahme.
Thank you, Monique.
All right, let's start with the basics. So, like, when somebody says I want a body lift, or when somebody tells you, what can I do here? What does that typically include, and who's a candidate?
Okay, well, this is a big subject because basically it's all about tailoring. And most
Mm,
people who come in for a body lift don't say that they're coming in for a body lift. I always start by asking the patient, what's the most important thing to you? And we go down the order of importance of what they want to have done. And, some people want to do the stomach first. Some people want to do the breast first. Some people want to do the thighs first or the face. So it's really a global sort of pan body endeavor.
mm,
So what do you do? Well, I try to first assess the patient's health. And some people are very anemic after, especially after gastric bypass surgery. So we have to boost their blood count. And I've had patients who've had to have iron infusions to get their blood count up because some of the gastric procedures prevent uptake of iron and so on. And so they're chronically anemic.
mm.
Most people, I tell them, to start with the stomach because when you do, the abdominal and sometimes the flank and the back surgery, they will lose weight after that. So they may lose
Oh,
another 10, 15, 20 pounds, which changes the face, which changes the breast, which changes the thighs and the arms and everything. So I usually
mhm.
like to start with the abdomen.
So if we talk about the midsection, and there's extended tummy tucks,
Mhm.
but did that only maybe wraps around to the flanks? And I've heard the term belt lipectomy.
Right.
Is that just like all the way around?
A belt is all the way around, just like the name suggests. It's a belt that goes all the way around, and that's for really, for people who have lost a lot of weight, and it tends to heal very well. We could keep the scar nice and low, and, it's a very good procedure. It takes about 2 weeks or so to really start the recovery from that, and by 4 to 6 weeks, you can usually do pretty much anything you want.
How long would you want their weight stable before they have a surgery?
Oh, I think that probably a couple of months is fine. You certainly don't wanna do anything in the middle of a weight loss program, but, once they're stable for a couple of months, that's usually enough. Although I have some people who come in and they've been stable for a year or 2, but more than a couple of months, I think is a good idea.
What would be the thing, I guess, or maybe 3 things that would prevent somebody from being a good candidate moving forward with a surgery?
Well, I think if they have a systemic disease, that's out of control, like, for example, diabetes, if that's not in good control, if they have a heart condition, if they've had a ton of abdominal surgery that might not lend itself to doing abdominal tightening. And then, things like anemia that we can usually correct. It's really a matter of general health.
So really, it's not necessarily like if the patient thought, okay, if I want my midsection, I want my thighs, I want my arms, my breasts, is it more determining like how many procedures, or does it come down to time in the OR?
Well, both. It's not really the number of procedures. I mean, we could do a little liposuction, do a brachioplasty for the arms, and do a tummy tuck, and various combinations. So it's not the number of procedures. It's really their general health and how long is it going to take in the operating room. And I'm a pretty quick surgeon, so we limit ourselves to no more than 7 to 8 hours of scheduled surgery. And that, doing that, you can usually fit in the tummy and the breast and maybe the arms or the tummy and the face. I don't like to do the abdominal part and the thigh part at the same time because it causes a lot of swelling in the pubic area, and that swelling takes a long time to go down. So I prefer to do the tummy and the breast, the tummy and the face, the tummy and the arms, that sort of thing.
Can save the thighs for
Save the
later.
thighs. Thighs are the last, I think, for most patients because it's a pretty long recovery.
Now, if it's a staged procedure, let's say we're gonna do,
Mhm.
the tummy and the face, and then we're gonna do the breasts and the thighs or whatever is decided. How long in between surgeries do you like to have? 6 months, or is it a couple months or a year?
I would say a minimum of 3 months, but I'd be more comfortable with 4 to 6 months probably.
So if we talked just specifically about, like, let's say the tummy tuck or a belt, like a 360,
Right.
really, because you're going around the
Going
whole
around
and
the
you're
whole
lift
body.
yeah, you're tightening
Some
up
people
that
think we cut
tummy.
them in half, but we don't.
And so you're kind of trying to get rid of all that extra skin, and is it possible to sort of create a waistline?
With extended tummy tucks and with belt lipectomies, you get a very nice waistline. You get that hip narrowing that really you can't get any other way. Not even with a standard tummy tuck because that doesn't really address the hips. So I
Mm,
used to do probably 90% standard tummy tucks. Now I do probably 70% extended tummy tucks so that we can get that nice curvature of the hip. And it really is a marvelous operation. And the only difference between that and a standard tummy tuck is that the scar is a little bit longer, but the scar is long anyway. I think that for the improved results, the extended tummy tuck is really great.
yeah. As we lose weight, our skin, and as we age,
And
our
as we
skin
age,
is more lax. I'm thinking about the buttocks. Now, if it was a belt and do you pull up? Do the buttocks get a little
oh yeah, you get
love
you
in the
get you
in
get a you
the
get a little butt lift from that. That's
Okay.
absolutely true. And that's what some people are looking for too. But it's a nice little bonus because you really get your abdomen very nice and flat for most people.
And the recovery for that would be, like you said, a few weeks. And are there drains involved?
Oh, yeah. We do have drains. For the belt lipectomy and the extended tummy tuck, there are 4 drains, and for the standard tummy tuck, there are 2 drains. And they usually stay in between 1 week and 2 weeks. And they are a hassle, but, they are necessary, and,
Mhm.
they really cut down on fluid collections after surgery, so they have their purpose, but people still like to be rid of them as soon as they can, and I do too.
Right.
I do too.
Yeah, yeah. Now, we had one of your patients on the
Oh,
podcast.
you did?
I can say her name because she's come on the podcast, Kathleen
Oh,
Listen.
Kathleen, yeah.
We talked about lymphatic drainage massage and therapy. And so tell me and I would think, I'm guessing that, for any kind of body lift, whatever combination, having that fluid helped along
Yeah,
by some massage is a good thing. What do you think about it?
I love lymphatic massage. I think it really mobilizes the fluid in the tissues and it softens things up. And Kathleen is really the master at doing the lymphatic massage. But I love massage. I think lymphatic massage is wonderful because you do, cause a lot of swelling and you interrupt the lymphatic vessels. And what Kathleen does is mobilize that and get the fluid out of the tissues. And she'll show the patients how to do it themselves too, which is really nice.
Yeah, yeah, and we'll put that in the show notes with a link to that
Yeah,
episode because
that'd
it's
be great.
really, really helpful. Okay, let's move up the body to the arms, and we're talking about a brachioplasty
Mhm.
or an arm lift. It's that kind of bat wing appearance that nobody
Yeah,
wants to have.
yeah.
So, what causes that? Is it just that the skin is stretched from being heavy, and then you're just left with a lot of extra?
Yeah, that's basically it. The same reason as the stomach and the thighs is that, there was fat there. Now that, and the arm was thick, and now they've lost the weight and now it's just a skin hanging. If it's just an isolated thing with the arms, and say somebody has heavy arms and the rest of them is normal, we can do liposuction, and that's very helpful. But
Oh,
once the skin has lost its elasticity, then you need to tighten the skin. And
yeah.
the brachioplasty is a scar that goes from the elbow, right here at the elbow, goes along the muscle here, the biceps muscle, and then curves into the armpit. You do have a drain for that. That drain stays in for only about 2 or 3 days. As with all these procedures, it's tailoring, and you're going to have some
Mhm.
scars, and you need to
Yeah.
accept that. And the scars usually heal very well, but they are there and they will be visible.
How long would a recovery from a brachioplasty take?
Oh, a couple of weeks. It's not, I mean, in terms of exercise and so on, I would probably say upper body exercises at least a month. But you can do pretty normal things after a couple of weeks. The brachioplasty is not that invasive and it's not that painful.
Really?
No,
Okay.
I've even done that
That's
under
good to know.
local anesthesia on a patient who insisted, and and she did just fine. So I don't recommend that. I don't think that that would be, my choice, but she insisted, and so we did it under local.
Now, could you combine the brachioplasty with the breast? If the breasts are being lifted and all that scar, can you make it
Oh
all
yeah,
one big happy
yeah.
procedure?
Usually, the scar from the breast, it goes underneath, and sometimes we can sort of just continue that incision up under the arm. So the breast and the arms go very well together.
Now, get back to the thigh lift, like what parts of the thighs does a thigh lift target?
Well, there are two types of thigh lifts. There's the standard thigh lift, and then there's the extended thigh lift. The extended thigh lift is a sort of a chevron scar that goes along the crease of the groin and then down the inner portion of the leg down to close to the knee. So you get both a circumferential tightening and a lift at the same time. I think that's a great operation. It takes about 4 hours to do. It does something that nothing else can do. It gets rid of that skin and looseness in the thighs. There's also another thigh lift, which just takes out a crescent from the upper thigh for those who have better skin tone and just don't need as much tightening. And
Mm.
but both of them take a while to recover from because the scar is it's in the groin, it's in a moist area, and there's a lot of motion at that. So we have the patients be pretty quiet while they're recovering from that.
Yeah, I was thinking mobility might be
Mobility
just a
is a
little
little
bit.
tough with a thigh lift,
Mhm.
but the people who have a thigh lift are ecstatic about the results because the results are, if you go through this, the results are amazing.
I know we have Renuvion, which is sort of a tightening device. Can you ever use that in conjunction with anything
I,
down there?
you know, I use a Renuvion mainly in the back when I do liposuction. I don't like to use it when I have incisions because it can
Mm,
burn and it can cause some problems because it's really about skin tightening. So you're injuring the skin from the underside, and with the surgery, you're injuring the skin from the top side, and I think it's a little risky to do that.
now, that's okay. We talked about belt, we talked about arms, we talked about thighs, and so the breast is the a breast. Do you call it a lift or a reduction when you've got a whole bunch of extra skin?
Well,
Because
it's
aren't their
more.
incisions are similar?
Yeah, breast reduction is mostly removal of breast tissue, which we'll send off to the pathologist to have a look at, make sure there's no breast cancer or anything. A lift is more skin contouring, and most patients benefit from an implant as well because with large weight loss, sometimes the breasts are really deflated, and you really need to lift them up and put an implant in to give them that fullness and the proportion that they have to the rest of the body. And that's, everybody wants to look proportional. That's
Right.
that's really one of the major goals of this.
Now, if we talk about what and everybody's definition of normal is different, but how long in general for any of these body lift procedures would it take for them to look normal?
Oh, I think they look normal normal, vastly improved, you know, you can see the change immediately. I mean,
Right.
it's not subtle. For some of these patients, we take off 10, 15 pounds and, it's in targeted areas. So when you take the dressing off a tummy tuck or a belt lipectomy, you're going to see a result right away. Same is true for the
Right.
breast. Same is true for the arms. Same is true for the face. So you
Mhm.
see an immediate dramatic change.
Would you say if somebody, let's say they're younger, they've, gotten all these things done and gotten all tightened up. What if they gain 20 or 30 pounds? What's going to happen?
Well, that's why I want them to be stable for a while so that that's not going to happen. And it's truly, the journey for them in terms of their weight loss and body change, that has been so much work for them that I I really don't see very many people who gain a lot of weight after this. They've worked so hard and gone through so much that it's unusual. I think that everybody has that concern, but if you gain 10 pounds or something like that afterwards, it's not going to destroy the results. It's not.
Okay. Now, we've talked a little bit about younger patients a lot of times have done this, but what if somebody's in their mid 60s or they're 70 years old? Is it still appropriate for them to have this type of surgery?
Yes, I think that the workup and the screening has to be a little bit more precise. And, as we get older, our heart gets older, our blood vessels get older. So, make sure that they are healthy. And it's really not about the age, it's about the physiologic health of the person.
And what advice would you give to somebody considering, maybe a staged procedure and feeling like if they're feeling a little overwhelmed?
Usually at the consultation, we go through everything that's a
Mm,
concern for them.
okay.
And then, you know, we try to suss out what is the main concern. I mean, if somebody comes in and I think, wow, you really should do something about that tummy there, and they say, no, people see my face and I'd like to do my face first. That's an important thing for me to know, and maybe we can do the face and the arms together or something like that, and
Mm.
then come back and do the tummy and the breasts later on. So it's really about what the patient wants.
In any of these little combinations, do they need to stay overnight in a, hospital or surgery center, or can they go home, or what do you recommend?
If the patient is in surgery for more than 6 hours, then we require that they have a caretaker overnight for the first night. And some people do it more than the first night. Some people don't have anybody to take care of them. There are various things, but over 6 hours in the operating room, we require an overnight stay. And it's usually an overnight stay in a hotel close by with one of our caretakers. It's an outpatient procedure, but we do require somebody qualified to take care of our patients if we go over 6 hours in the operating room.
And then compression garments. How long do patients typically wear a compression garment after surgery?
Well, compression garments are very important. I mean, they can't be too loose, they can't be too tight, and the body changes afterwards. So we give people two garments, one for, the surgery and one when the swelling has gone down a little bit so that they can remain snug. We tell patients to wear them for 6 weeks, but a lot of patients wear them a lot longer than that. They just feel more comfortable, having that security of a garment. So it's not unusual for patients at 3 months or something, still wearing some sort of garment. And I tell them that, you don't have to wear this big surgical garment for that long. You can go to Spanx, or there's a whole host of, over the counter type of garments. And also, Amazon has an incredible selection of garments for that different comfort and so on.
Okay. And is your typical timeline for, let's say, physical activity? What's the timeline for walking versus, because maybe some people, once they've had this weight loss, they've changed their
Yeah,
habits, and then they're really antsy and kind of paranoid to get back to whatever activities they were doing so that they don't lose
right.
that momentum. And so what are your rules around getting back into
Well,
exercise?
again, the rules are they are strict but flexible, so everybody recovers a little bit different. But usually at about a month or so, you're not going to hurt anything. The drains are out, the sutures are out, whatever sutures we used. And, if they feel like starting to take walks around the neighborhood, things like that, then that's fine with me. I think for people who are competitive gym rats, probably 6 weeks. And then I tell them, listen to your body. If it hurts, back off. And
Mhm.
for abdominal surgery, we don't want them to do any crunches or sit ups or anything like that for at least 6 months because we tighten the muscles and we don't want those sutures to pop loose. But we see these patients very frequently in the first month. I mean, at least on a weekly basis for the first month. And so we know when they're ready and we know when they're not ready. And
Okay.
so they get to know the nurses, they get to know us really well.
Now, the big I word, insurance. Does insurance ever cover any of this kind of surgery?
Less and less. We don't do insurance in La Jolla Cosmetic Surgery. Sometimes in patients who have a really big abdominal apron, that hangs down to their knees, they get infections and so on, that can be really quite serious in all that extra skin that hangs down. And insurance at in some cases will cover this, but only for the very most extreme excess, and it's only for the abdomen. They never cover
Mhm.
the arms. They never cover the face. They might cover the upper eyelids, and they do not cover the thigh plasties either, the thigh lifts. So
Okay. And what about the breasts? No?
they might cover a complication if the patient has implants and the implants are ruptured. They may cover that, but insurance companies are getting tougher and tougher, and especially with all the bariatric surgery and the weight loss, and the backlog of patients who want to have body altering surgery, they're not really covering much.
Right. And this is why we have, patient fi and care credit, and,
Right.
that really helps patients to say, okay, I'm going to do it like a car. Think of it like a car,
Yeah.
and I'm going to have a financing plan and pay a certain amount per month and be able to kind of break it down that way,
Yeah.
because
And
it
that
is
makes a
true.
huge difference for a lot of people because, these all day surgeries and recoveries, it's expensive. There's no
Mhm.
question about it. But, our coordinators are great at getting this taken care of and getting them signed up for financing. That's really great.
Yeah, yeah, and just think, if you put part of it on a credit card, you're gonna get miles,
You're
so you
gonna
could
get
go somewhere
miles.
with your new body. You could, like,
Fly
decide where
somewhere.
you wanna go.
Yeah.
Yeah. During the consultation process, the kind of the last wrap up here is, how do you best show patients what you can do for them to,
Oh, we
get the result they're looking
yeah,
for?
we have a great tool in the office called TouchMD, where patients who've had surgery have given their permission for us to use their pictures in the office. And so we have some on the website, and then we have hundreds more in the office. So we can show you pictures of people who look like you, people who've had the same operation, and so on. So that's really helpful. And we go through that with everybody in a new consultation.
And do you have a protocol for scars that you prefer for the patients as they're healing?
Yeah, I mean, we keep the scars taped for 6 weeks or so, and then we start scar gels and scar creams and scar tapes for some patients, and then most people heal very well. Some people have some hypertrophic scars, and we end up doing some injection with steroids to try to calm that down.
So, in terms of pricing, I know you don't deal with that, but when you have that consultation,
Hmm.
and you figure out, okay, let's start with, let's say, the breasts and the arms, and then the tummy and the face in stage 2, or vice versa. We'll give a quote, and then you'll have the hard costs. But on our website, prior to that, if you're just kind of curious, we do have a listing of all of the different ballpark price ranges. So we'll put a link in the show notes to that page, because that does help you get
Oh yeah,
your head wrapped
it gives
around.
you a ballpark.
Yeah. So then, once you have that consultation, then you know exactly what you're looking for and
Right.
can make a plan. And I think that's a really nice thing. Now, if somebody who's listening today doesn't live in the area, can you do a virtual consultation with them?
Sure, we do that. I don't operate on the basis of a virtual consultation alone. So they'd have, if they decide that they want to go ahead, then they'll have to come in to confirm everything. Depending on what we're doing, they'll have to stay around for anywhere between 3 days for a minimal procedure to maybe 2 weeks for a bigger procedure.
Right, right. Our coordinator team, they're so good
Oh,
at
they're
helping,
great.
helping you get the financing, helping you figure out if you're from out of town where you want to stay, or even if you live in town and you just want to not be at home for
Yeah,
that first night and have that
a
aftercare,
lot of people do
that
that.
nurse, and be in a hotel away from the kids, and
Yeah,
it's
especially
just
especially
sometimes
if there's
nice.
small kids around, it's nice to just have that first night, where you can relax and be a little bit fussed over.
Yeah, fussed over. I like that. Well, thanks, Dr. Brahmi. Do we kind of cover
I think
everything?
so. I think so. And whatever we didn't cover, people can come in and ask in person.
Right, exactly. Well, thanks everybody for listening. Check the show notes, and we will see you on the next one.
Okay.
Thanks. Bye
Have a
bye.
great day.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code PODCAST to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego Freeway in the Zymed building on the Scripps Memorial Hospital campus. To learn more, go to ljcsc.com or follow the team on Instagram at ljcsc. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.